Hi, my name is Kate and welcome to my channel. Today I'm very excited to introduce you Deborah MacNamara. She is a clinical counselor, educator and author with more than 25 years of experience. She is a faculty member of Neufeld Institute, focusing on developmental psychology, attachment theory, neuroscience and practical parenting strategies. Deborah is an author of best-selling books. One of them is Rest, Play, Grow, and the most recent one is Nourished, Connection, Food and Caring for Our Kids. She also presented to United Nations and Dalai Lama Center for Peace and Education. I hope you will enjoy our conversation with Deborah. Let us know in the comments your thoughts, and please don't forget to subscribe to our channel and share it with your friends. Could you talk a little bit more on the attachment itself, if we're talking about preschoolers and young children in general, and why is it important so much?
Well, that is the question. Relationship is everything to all of us, and at the very beginning of life, as we emerge as a young infant, all the way into 5, 6, 7 years of age, we're really developing the foundation for how we become a relational being. So attachment is that foundation. It is the context in which our children want to follow us, want to listen to us, want to be like us, want to look up to us. If we have a relationship, it makes our job a heck of a lot easier in terms of taking care of our kids, because we can influence them, we can orient them, we can keep them safe, we can help them. If we don't have relationship, it's pretty difficult. I would also add that I don't think we need to tell parents how to love their children. I think by and large, parents, we do have instincts and emotions to love our children. So the question is why do we have to talk so much about attachment? And part of the reason is because culturally there is a shift towards more separation between adults and their children. And I don't mean daycare. I don't mean women going to work. I mean fundamentally, there isn't an understanding that children need to be connected to whatever and whoever adults they are being taken care of by. And we've lost that intuition. So I think that's the key thing that we've got to keep in mind with our young kids, is they always need to be attached to the people who are taking care of them when it comes to their adults. So what's the nature of a good relationship? How would we know we had a good relationship with our child? The key thing here is, and again, I come from a developmental relational point of view based on the work of Gordon Neufeld, is does the child depend on the adults who are responsible for them? Do they turn to them? Do they orient to them? Do they seek them out? Safety only exists when you are in relationship. Like a child doesn't feel safe outside of relationship. And as Gabor Mate says, safety is not the absence of threat, it's the presence of connection. So you could actually be in a situation where things necessarily aren't safe, like in a classroom with lots of kids who could come at you in many different ways. And the child doesn't feel unsafe because they're connected to the adults who are responsible for them. So it's about dependence. Does the child depend upon the adult who is responsible for them? That's the nature of a good relationship. Do they want to be like them, talk like them, share their secrets with them, share their heart with them?
What is happening when the attachment is not there?
If you're an adult, you know how tricky relationships can be just as an adult with friends or partners. And we were children once, we realized with our own parents or teachers, relationships are full of emotion and sometimes we get hurt. One of the greatest challenge in our relationships today with our children, and this is from a cultural level, is the overturning of the caretaking relationship, meaning that children seem to be are more bossy, commanding, demanding, telling their caretakers how to take care of them. There's many reasons for that. Part of it is cultural, part of it is our parenting practices, where we put our children too much in the lead, where we consult them with too many questions. We explain ourselves a lot. Far more than I think children really need to know sometimes. And again, every parent must be the judge of that, what is developmentally appropriate. But every time we put our children in charge of things like attachment or food, of course we decide what we're going to serve, but our children must decide what they want to eat. We can't force feed our kids. They have autonomy over what they like and not like, but we ultimately have to decide how we're going to take care of them. How we walk them towards, bedtime and taking care of them at night when separation is so big. There's so many issues as a caretaker where we have to take the lead, and we need to be both caring and firm. Past generations and practices in parenting wasn't always kind, wasn't always compassionate, didn't always keep relationship in mind. It was kind of my way or the highway, consequences, threats, bribes, punishment. What we're trying to do today is to be able to take the lead and to have our children rest in our care. If we don't do that, then our children will take the lead out of default. Someone has to lead. But it shouldn't feel abusive. It shouldn't feel wounding. It should feel like we can count on and trust in that person to take care of our best interests. I think the key issue here with dominance issues in our kids is that we have growing numbers of children who are taking matters of attachment into their own hands, essentially. And that will make them insecure, because you're not meant to take care of attachment. You're meant to rest in the care of adults who take care of you. That's your sense of safety comes from that. It doesn't mean that you do everything they ask. It doesn't mean that there aren't disagreements, there isn't upset. It doesn't mean that the adult doesn't have to take into account the child's wants, wishes, desires. It just means we need to take the lead on matters that are in their best interest, and to walk them through challenging times if we have to say no to things, but to make sure that we're not replaced in terms of the caretakers that they need. They're not ready to go it alone. They're far too dependent. They still need us. Our teenagers still need us, but we can't take care of them exactly like we would take care of our 3-year-olds.
From your practice with a lot of parents, you have seen these dominance issues a lot, and maybe you could give a couple of examples. How does this manifest itself in like regular life in somebody's family?
Yeah. Oh, such a great question. And it can be so different in every family. But there's a difference between a child who says, I'll do it myself, and no, don't help me once in a while, and generally, abides and follows a parent, and a parent can lead that child, to the difference when a child seems to say no at every turn, doesn't follow, tells a parent what to do, is very frustrated when there's limits or restrictions a large percentage of the time, not just a little bit, like as kids come and go, but like it seems like almost everything. They don't seem to follow. There can be not everyone, but can be really anxious and alarmed at bed, and bedtime can be drawn out, and it can be very rigid. You could have a child who doesn't let you in to comfort them or cuddle them, and everything has to be on their terms. They might be bossy, commanding, and demanding around their food. You usually see issues around frustration, resistance, food issues, and the child just seems more restless, agitated. And that's a continuum. Like, it's not a diagnostic label. It's a continuum where you're like, what is off with my child? They can't seem to settle into play. They can't seem to grab them and lead them as much. They're not as receptive, and it can seem to slowly disappear, where things just get harder. Parents will often tell me that they're exhausted and they're working very hard to take care of their kids. They don't understand. They're trying really hard to be patient. But they're like, what has happened here that my child is no longer receptive to my caretaking here and is bossy, commanding, demanding, or feigns helplessness? I can't do it, or tells me what to do. These are just some of the ways that it shows up. But I can tell you, for parents who love their children dearly, this is really hard. The child feels insatiable, and the parents typically can go harder on the child, take away things, use more consequences to show them who's boss. Everyone will say, oh, you have to show the child who's boss. And some parents just give up and say nothing's working. Neither of these approaches work, but I can understand why parents get into that situation. Why? Because you just feel at a loss to make sense of it, because at the root of it, at the root of the anxiety, the frustration, the resistance, everything that's happening here is the relationship the adult needs to lead. The child is very attached to the parent, very attached, but is trying to lead in the relationship. They have to rest in the care. You can't work for love. You have to rest in it. And so that's just, a very high level snapshot of what it might look like, but it is definitely a continuum.
And you already touched on that, like about, you were talking about some parenting practices that we have right now that could lead to this specific dominance issues. But could you elaborate maybe a little bit more on a couple of those practices? I know you, in your book, you have around 7, if I remember correctly, but maybe you could elaborate on some of them. What are the most common and you find the most, difficult to overcome?
Well, I think we care deeply about not wounding our children today, and I understand that, and I understand where it comes from. And so we're very thoughtful about how we show up with our kids, not necessarily everybody, but by and large, and wanting to give our children autonomy, yet at the same time preserve our connection. And so I think it's kind of like riding a bicycle. You can feel yourself veering from one side to the other. You don't want to be too hard, but you have to have limits. And yet at the same time, you can't just be a passive recipient and just simply do as your child tells you to do. They'd have cookies for breakfast, lunch, and dinner if we allowed them to do that. That's what I would have done as a kid. So they don't always know what's in their best interest. We can't blame them for that. So some of the practices here, I think we're in a fundamental shift and a paradigm shift, and so it can feel very confusing. I think that the asking of too many questions, of saying, well, what do you want? What do you like? Because there's this belief that helps create more independence in a child. We all want our kids to be independent, but understanding that fostering that dependence on us is actually the developmental root from which a child grows. All plants need to be rooted very well, very strong, and they grow more robust with those deep roots. So we don't want to put our children in charge of a relationship. They have to be solid and secure in those roots. So asking too many questions about things that should really be ours to decide can make them, we can talk ourselves out of a job. Now, that doesn't mean that they don't get to decide what food they want to put in their mouth for what we offer, or what they want to play with, or what kind of clothes they want to put on, or when they get older, when they're going to do their homework. I gave my kids lots of autonomy around those things. But eating or wearing clothes wasn't really an option, or brushing your teeth. It's just we have to work with what we've got. I think we explain ourselves a lot. I think we're trying to get our children to buy into our ideas. Don't you know this is what it does, and this is what it means, and screens aren't good for you, and too much sugar is bad for you. And it's just like we educate them on everything. It's like information doesn't make a child feel safe. The adult does, the relationship does. I'll take care of you. Come with me. And I find that over and over again, that during natural disasters or any big things that are man-made disasters too, that the biggest questions parents ask is, what do we tell our kids? What do we tell our kids? Information doesn't make them feel safe. The adult who says, I'll take care of you, come with me, I know it's scary, I've got you, and finds a way through. So we've got to hold that position and not give away too much. I think parenting at its best is very much a covert operation. We do a lot of caretaking, we do a lot of thinking about our kids, but we don't have to share that all with them. And that can actually make, especially some of our very sensitive kids, feel very insecure if we're oversharing that way as well. I think the number of parenting experts that are around and the proliferation of social media is the answer to go to. While I think there is absolutely some value in it, of course, that's partly what I do, it's also problematic. It's a double-edged sword. Because when you're looking to someone else to feed you answers, you're not finding the answers inside of yourself. Well, a parent will say, well, listen, I'm confused. I need to look for some answers. Well, I get that, and I understand that. At the same time, it's okay to sit with something that isn't working and give yourself some room to figure it out and to try some things, to think it through and try some things. You don't have to worry about just getting everything perfect or right. Nature is forgiving this way. You're going to figure it out. You care about that child? Trust me, no one's going to hang in there as long as you are to try to figure out how to get that kid to bed or how to eat broccoli without using coercion. Like, you're going to figure it out. Just give yourself some room and space. And so I would love to say that to every parent today, is just hold on. Don't be too hard on yourself. Like, just sit with the questions you have, get information where you need to, but realize fundamentally that you're going to find the answer between you and your child, and that's the best way forward. So I think we're impatient. I think we turn over too much of our parenting power to experts who tell us how to raise our kids. By the way, there's been a lot of experts who can give a lot of really poor information, And it's devastating to see the impact, because the parent says, "Yeah, that doesn't make sense. Why did I do that?" Well, question things. So there's many ways that this is happening.
I could definitely relate to this overwhelming amount of information, which is not working really well in many times, and at the same time you don't have you feel. And to what you said, I also feel like there is some sense of trying to be very good or almost perfect in the parenting, which I don't think ever supposed to be.
Yeah, or calm. Like, yes, on the outside, you don't want to deliver your unfiltered emotions on top of your child, but we are anything but calm. I mean, we're frustrated, we're worried, we're upset, we're excited, we're sad. It doesn't mean our children have to see or bear all of that. Sometimes they do, but I mean, generally we're not going to be calm. The idea, if I had to think that I had to only be calm when I was a parent, there would be very few windows when I would be able to parent.